Now that it's spring, many people are picking up their favorite outdoor sports and activities, but activities like golf, tennis, and baseball can cause pain or injury to the shoulders. Here to talk about symptoms and treatment options is Dr. Robert Boswell, an orthopedic surgeon with New Hanover Regional Medical Center. Thanks for being with us this morning.
It's my pleasure. Thank you for having me.
So what are some of the most common injuries then to the shoulders?
Some of the most common injuries that I see are associated with the rotator cuff. They can occur either through an acute episode, such as a fall, or overuse type injuries, such as going out and throwing the baseball a little too vigorously for a little bit too long of a time, or insidious in onset, or what we would describe as chronic. These injuries can occur over a long period of time without a specific incident. So rotator cuff injuries are by far the most common thing that I see.
That's something you hear a lot about, too.
Absolutely.
Hear people talking about the rotator cuff. So what are some of the symptoms then of those injuries?
By far the most common symptom is pain. People will come in and say that they have a great deal of pain, described as a deep ache or a toothache in the side of the arm, worse with activities such as raising the arm overhead. And it's also worse at night. Sleeping on that shoulder seems to be very painful. Other symptoms include loss of mobility or stiffness in the shoulder and weakness, such as the inability to raise the arm overhead.
So if someone thinks that they may have injured their shoulder, what should they do then?
Initially, I think a trial of just simple rest, over-the-counter remedies such as ibuprofen or naproxen can be very effective, ice or heat. But after a period of time, if your symptoms persist, I think you should seek your care at your doctor.
So if someone decides, yes, they need to go see a doctor if the pain's just not going away, so what treatment options then are available?
Well, what we traditionally use are prescription-strength anti-inflammatory medicines. Injections such as cortisone injections can be very effective at alleviating the pain and inflammation, and physical therapy, which is a way of rehabilitating the shoulder to get it stronger and over the injury itself.
And I guess, and then is the final step, then would that be surgery?
Right. The final step in that algorithm would be surgery. If all else fails and your symptoms persist, you would be a good candidate for surgery. And it also depends on what the injury is. If it's a rotator cuff tear, then I think surgery is going to be very effective at fixing that tear.
So who would be a candidate for that then, for surgery?
Someone who has failed conservative management and somebody who has a complete or full thickness rotator cuff tear.
So no age, does that matter?
There is probably an age, but we do it into the 80s and we do it in the teenagers.
All right. Well, Dr. Robert Boswell, thank you very much for being with us this
Thank
morning.
You.
For more information on this topic or for information on New Hanover Regional Medical Center's Live and Learn Joint Pain Seminar in Jacksonville, go to nhrmc.org or call Vitaline at 910-815-5188. It is